Hello, today we will be talking about AP lower ribs and how to set them up. First, we need our patient preparation. We need to introduce ourselves, state that we are going to be taking our images to our patient, and ask our patients for their full name, date of birth, and last menstrual period if needed. The, the image receptor size for this image should be 14 by 17 cassettes. The image orientation should be landscape, and our image receptor location will be the wall bucky. Our SID for this image will be 72 inches or 180 centimeters. Our patient position for this image should be is that our patient is erect, preferably, or supine, depending on if the patient is able to stand up or to the extent of their capabilities. The part position for this will be that we need to align mid-sagittal plane to our central ray, and we'll need to align to the midline of the table and wall bucky. Our central ray location should be at centered mid-sagittal, midway between the xiphoid process and the lower rib margin. Our central ray angulation for this should be perpendicular to the image receptor. Our collimation for this should be that the collimation should be the full length of the image receptor to ensure that all the lower ribs are shown and nothing is cut off. The visual of appropriate marker location for this should be anywhere on the left or right of the lower abdomen, so long as it is not in the anatomy of interest. The KVP range for our real patient for this image should be anywhere between 75 to 85 KVP. Instructions to the patient for exposure should be that we need to have our patient do full expiration breathing techniques, where we will expose on the second deep expiration. We will need to have our patient take a big breath in, blow all the way out, take another breath in, and blow all the air out, and hold, and then breathe again. The anatomy demonstrated in this should be ribs 10 through 12 should be visualized within this image. Our items in profile should also be our lower ribs, and the pathology that best demonstrates this clinical indication will be the pathology of the ribs, including fractures and neoplastic processes. All that is how we will position our patients for our AP ribs lower segment and what is needed to be able to get our good image.